Awesome, we are back. Of course, there's always a little bit of technical difficulty. We're on the Zoom meeting. Can you hear me? And I'd like to introduce Kasey Claborn, who's coming to us live from Texas and has been doing amazing community-based response work with an amazing pilot that she is going to tell us about. Throughout the pilot project, the thing that we were really excited about hearing is that they use the co-design process to develop the platform, which she's going to talk about, and that is in complete alignment with the way that Brave tools have also been developed, and we believe deeply, deeply in co-design and design justice, which has been utilized here. Without further ado, I'm going to leave the screen. Put your questions in the chat and I will ask them for later.
Okay, can you see my slides? Good. All right, well, thanks everyone. This was such an exciting symposium for me to see, especially with technology and harm reduction. You know, I think as I've been doing this work, I am a research scientist at the University of Texas, and I've worked in addictions research and also health technology research for a while. And I love that we're starting to see community being emphasized. We're starting to see co-design processes. And hopefully moving forward, we'll really see lots of impact for how technology can really improve harm reduction efforts moving forward. So today I'll be talking about our work that we've been doing on a project called TexCope. It's Texans connecting overdose prevention efforts. This work is funded through the Texas Targeted Opioid Response Program and through SAMHSA. We also received a very small award from Google to facilitate our Google Cloud platform. And I have no conflicts associated with the development and presentation of this project. So a couple of years ago, the Texas Targeted Opioid Response Program through the Texas Health and Human Services Commission approached me. You know, we knew that data for overdose was severely underreported in Texas. Texas, as you're probably well aware, is a very large, diverse state. And so it makes it just tracking overdose is extremely challenging. And really to have data-driven prevention and response efforts was, you know, completely lacking. And it's improving, but our goal with TexCope and with this project is that we'll be able to have better data from the community.
Kasey, yes. I'm so sorry. You're going to have to take your, stop sharing your screen and then reshare it with the PowerPoint because no one can see your slides. And we're all, so just, I'm so sorry to interrupt. There's no enduring way to do it. All right, let's try it again.
Okay, can you see now?
There it is, yay, all right.
Okay, sorry about that. All right, thanks for interrupting. So what we're doing with the state of Texas is we're really trying to harness community data to inform our prevention and response efforts, and also to improve policies so that our policies in Texas, if you're not familiar with the conservative nature of Texas and harm reduction, we really do need data to support policy advocacy across the state. And so we're hoping that through the TexCope platform, we'll be able to actually have the data to inform our community response efforts, as well as to advocate for policy changes moving forward within the harm reduction space. So we know that we need better surveillance as it relates to both fatal and non-fatal overdoses in order to have this data-driven response. And so we developed what's called TexCope, and we had 4 specific aims for this project. The first aim was to develop a digital platform that improves surveillance for fatal and non-fatal overdoses, as well as help us to understand naloxone distribution and administration across the state. It's a very large project, so you'll see why it takes a lot of resources, and it truly takes a village with our community partners to actually make this come to life. Our goal is to also eventually integrate with existing overdose data sources so that we have a really robust data platform. And then we can start doing these data analyses to inform our community health paramedic programs and our harm reduction programs throughout the state. So about 3 years ago, we started to develop this partnership with the University of Texas at Austin, with our community partners across 4 different counties. And I'll show you those counties and community partners in just a second. And then also with an industry partner. So we needed somebody who we knew could do this on a large scale, and to do it where it's HIPAA compliant, it meets all of the regulatory and federal compliance issues associated with what we're trying to do. And so we're partnering with a company called Maven Wave out of Chicago to help us do this work. Whenever we started this project, we wanted it to be community driven. And so we are using what's called a community engaged research approach. And so I had ideas, you know, working in this space from an academic standpoint about what I thought we should see. But I really didn't want that to drive the project. And so what we did is we went to the community, and, you know, our theme throughout this project has been, you know, nothing about us without us. And so even though I'm the lead on the project, I don't really make the decisions. The decisions truly lie within our community partners and our community advisory board members. So we have community advisory boards across 4 different counties that have driven every piece of this project. So they have driven the research component, the design component, and they're now driving our implementation component. And we chose El Paso County, Travis County, which is Austin, Texas, Williamson County, which is our rural community that's north of Austin, and then Bayer County, which is our San Antonio area. We chose these because they're very diverse, and we also have very strong alliances and partnerships with the harm reduction and community health paramedic programs within these counties. So these 4 community advisory boards have really helped to build what I'm about to show you, which is our TextCope platform. Prior to figuring out our solution, after we knew the problem, we wanted to do some research to help to understand the gaps in overdose reporting and gaps in overdose surveillance, but more importantly, to understand what the community concerns will be, and also what our harm reduction partners really needed out in the field. And so we conducted over 100 qualitative interviews with people who use drugs, people in recovery, people who have experienced overdoses, and then also harm reduction workers and our community health paramedic workers as well. And then we did process and field observations because we really needed to understand how our harm reduction partners work, what it's like going out into the field, and how we could develop a solution that really fit into their existing workflow and wouldn't cause additional barriers or burdens for them. And really what we found were 2 specific themes associated with these data. So from a technology or a technical standpoint, all of our harm reduction partners wanted a unified standard system for overdose reporting across the entire state of Texas. They wanted one system that they could use, that they could share information across other harm reduction organizations that would help to improve their processes, but more importantly, give them an understanding of where they needed to allocate their resources for their community outreach efforts. And then from a humanistic standpoint, this is primarily coming from our people who use drugs and community partners. They really wanted us to focus on privacy, making sure that we're preserving the community trust that our harm reduction partners have already built, and that we're completely transparent across the board with how data is being used, and really maintaining a sense of anonymity as well. So we conducted, with our community partners and our technology team, we went through a phased design sprint for the technology development component. And I won't go through each of these details, but it was really fun working with our community advisory board members. We have local street artists that we've hired who do all of our artwork and all of our designs, and just brainstorming and sketching it out with them has truly been such a fun project. So like I said, I really haven't done anything. I just kind of coordinate all of the pieces to make this come together. And this is the harm reduction dashboard that we've developed. So this is the first phase of the project that we just finished piloting with our harm reduction organizations across those 4 counties that I mentioned previously. What we've done with this is we had our harm reduction organizations throughout the pilot tell us what they like about the the platform, what they don't like about the platform, and then also what we need to build out. And so we're still finalizing development of this because they've continued to give us feedback. Some of the key components of the dashboard, and I'll share with you a link, it's a YouTube link where you can see a demo of the entire dashboard from what we've built out so far. But key components include having an anonymous overdose report form, and then also a supply management component. So keep in mind, this platform is free to any harm reduction organization in Texas who wants to use it. And one of the key pain points that our harm reduction partners told us is that they just use Excel basically to track their supplies. And so they wanted an easy way to where when they're out in the field that they can track the number of kits that they're giving and then their supply distribution and be able to map it on. And so in the demo, you'll be able to see some of the really unique features that we've added associated with that. But really what this does is it looks at each harm reduction organization. They can see what supplies they've distributed, what drugs are causing overdoses within their area, the primary ones, and also what their organizational impact has been over the past year or over the past month. And and I should have put a screenshot of this up here. We have a data dashboard for each organization so that they can use these data points for funding, for grants, and also to show their impact. And so we have different charts associated with how they're distributing supplies in the community, different maps that show hotspots of naloxone distribution, overdose occurrences, and then also different demographics associated with the data that's being inputted into the system. So where we're going next is we are currently about to launch our statewide dissemination among harm reduction organizations across Texas. We anticipate this will take probably about a year to ramp up statewide. We're focusing primarily on the urban areas where Texas has strong harm reduction organizational presence right now. And so we're hoping that by the end of the summer, we'll have launched pretty widespread across Dallas, Houston, and most of the urban areas in Texas. We are currently working with our community partners and a team of people who use drugs to actually develop a community dashboard. So it will be linked to our harm reduction organization dashboards, but it's really a dashboard specific for the community where we'll be able to provide spike alerts when overdoses occur or fentanyl is detected within particular areas. And then we're also developing a solution for first responders. And when I mention first responders, I'm primarily talking about our community health paramedic programs. So we're intentionally not including law enforcement at all in the data collection process, or and they will not have access to any of the data dashboards or anything like that. And our overall goal is to really work with our community health paramedic programs and our harm reduction organizations to have data-driven response and prevention efforts across the state of Texas. So you can click on that QR code. It'll take you directly to the texcope.org harm reduction site. And if you have any questions, definitely, or would like to collaborate in the future, please email me or contact me. So thank you all.
There's a lag. Thank you so much, Kasey. Look forward to connecting with you really soon. There are some great questions from some folks. Teresa asked, what most surprised you that came out of the co-design process?
Yeah. I think in our initial mock-ups before we started the co-design process, because to get the grant, we had to come up with a design. I hadn't looked at that in 2 years, and I found it about 2 months ago. And the initial design that I had mocked up in order to get the grant funding has been completely erased. It is totally different than what we actually ended up developing. And so, we tried to approach this in a way that it's going to, really address all of the pain points that our partners are really dealing with. And in doing so, when we're looking at it from an academic lens and just trying to improve data, we don't think about boots on the ground and what the community needs in the moment. And so we had initially thought that we would just be building out a couple of mobile applications. And instead, we ended up building out this huge, robust digital platform that is tailored to specific user groups. And so I think, we have it increased tremendously. And then also just the emphasis on preserving the trust in the community and being able to work with our local street artists to do all the artwork and the design. It really has helped to change, I think, the way people will use the system. So it's been an amazing process.
Have there been any hurdles that you've had in terms of maintaining privacy and security?
So we haven't had any problems maintaining privacy and security at this point. So we're working on getting a certificate of confidentiality that will protect, just in case there's a court order or anything like that, it'll protect us against releasing that data. But as far what we've come across is lots of concern among the community about privacy issues and how the data is being used. And so when we're talking about adoption within the community, that is our primary hurdle that we have to overcome and that we have to focus on. So it hasn't been a technology challenge, but it's been a community challenge, absolutely.
Yeah, 100%. Would love to hear some more about the process of co-design and combining these two different worlds.
Yeah, so, COVID honestly made it very challenging because a lot of times fortunately, I had already built a lot of partnerships among some of our harm reduction partners. And so it was easy in those areas to transition and still work remotely and try to build those partnerships. But especially in working in El Paso and San Antonio, where I didn't have pre-existing partnerships and I didn't have that trust. Having to build that in a remote virtual environment was extremely challenging. Trying to work with our street artists and trying to work with people who use drugs who, they don't have access to Zoom, or that was a big challenge. And I think too, from an academic standpoint, we have so many regulations that we have to go through and so much red tape to get anything passed through the Information Security Office, for example, that it takes a long time. And our community partners, they like to move fast for good reason. And I love that about them. But having to balance the academia bureaucracy and the community wanting it to go out and just get out there now and start making a difference, that was probably our biggest challenge in working with them in the co-design process.
It sounds like we have some very similar challenges.
Really? Yeah.
Yeah, 100%. Love that. So thank you so much for your presentation. I do believe that you have an expo. You have a spot in the expo, is that right? No? Maybe not.
Actually, don't.
Regardless, at the end of the symposium, by the end of the week, we will be sending out everybody's presentation and PDFs, contact information. So if you want to connect with Kasey directly, or you want to learn more about their work and the amazing work that's happening in one of the most conservative states next to Ohio, West Virginia, doing some, this is extremely radical to be bringing in all of these worlds together, to be collaborating in this space and to be getting harm reduction into the hands built by and for drug users and the service providers who are in their community. So very exciting. And now we are going to take a short break, and then we will be back with Tara Taylor and the MySafe, which is going to be very exciting. And we shall begin again in, let me out, reading at 1:10. So hydrate, people, go outside for a walk, have a scream, vape away, drink some caffeine. Do what you got to do, shake it out, put on your favorite music, and we will be back in 11 minutes.